Last night was mad real.
What we represent, man?
Big money bound.
So let her know, man.
Big money bound.
We got the kids, man. We got the kids, man.
Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release unscheduled videos throughout the week. If you're returning, welcome back. I appreciate all of the support. Thank you. Last night was my first day back from 3 days off. I had 3 days off in a row, and I really enjoyed my time off, man. I got to spend time with my family. I got time to make YouTube videos. I got time to really just think back and kick back and just think about life. Just like my goals, how far I came with it, man. Just this year, like how all the things I accomplished in this year, how blessed I am. So those good 3 days off was needed, man. And I'm trying to make it I'm trying to make it my business to not work so much more overtime going into the remainder of the year. I'm just trying to work one extra day a week. That's all. Like, no more 5 and 6 and 7. So I got my newborn baby at home, and I really want to like be there and see him grow. Cause it's like the man growing like this. Every time you look at him, he getting bigger. He getting bigger. He getting bigger. He getting bigger. So I'm really trying to be there for that. But last night they had me in. Make sure my lips ain't too chappy, man, because I'm probably dehydrated. Last night they had me in the unit. It was a pretty easy night. All I was covering was a unit, and I was in the unit where it's long-term vented patients. So all of the patients were on trach collars. All of the patients had trachs that was on vents. And all the patients that wasn't on vents, they had trach collars that was on cool aerosol mask trach collar. So I think I had 6 vents and like 5 cool aerosol trachs. So that's like the hardest part is just the first round. Everything after that, it gets kind of easier and easier because you don't see the patient like so many times. Your initial vent check, your initial patient assessment, that's the one that's like so deep, so in depth, that it takes a little bit longer. So that's what make your first round like the longest or the hardest. And with those trach patients, like you really gotta like suction, man. It's like mucus flying everywhere. But one good thing about having the trach patients at this hospital is the respiratory therapists aren't responsible for doing trach care. I know like everywhere else you go, a lot of places that you go, the respiratory therapists are responsible for the trach care. But at this hospital, that's a nursing duty, not a respiratory therapist. So we don't do trach care. I know that sounds crazy. Please jot down in the comments and let me know where you're at, where you intern at, where you work at. Do respiratory therapists do the trach care? Because in school, we learned how to do trach care because that was something that the respiratory therapists did. But once I got to the job, that's something that the nurses do. So hey, I don't mess with it. But 9 times out of 10, it's a nurse that's kind of like unfamiliar with the trach care, and they kind of like scared all the mucus. So I'm always willing to help them and show them what's really going on. Speaking of what's really going on, when I came into the unit, it was a patient room I had to go into. And there was a family member of that patient in the room waiting to see the nurse. So they're outside the room, like just waiting, looking around, looking out the hallways, looking around, just getting very impatient. So when it's my turn to go into the room, they don't care that I'm the respiratory therapist, that I'm not the nurse who they want to see. All they know is it's somebody from the medical staff coming into my room to see my family member, and I got a whole bunch of questions to ask. So I'm finna bombard him with questions. But with me, like I'm a seasoned respiratory therapist, so I know that when it's a family in there waiting to bombard you with some questions, the way to defuse that situation and to get around all that, you bombard the family first. You just gotta bombard them. Hello, I'm Randy from Respiratory Therapy. I'm here to take care of your family member. I got their breathing treatment. It's gonna be Q4 breathing treatments. This breathing treatment is a dual neb. It's a bronchodilator. It's gonna help keep the patient's lungs open, help them keep breathing nice and easy. And it's gonna last about 10 minutes. I'm here through all out of the night. You say so. You just keep saying so much stuff. They be like, okay, thank you. I appreciate that. So You don't tell them everything that you finna do, what you doing, who you is, why you doing it, why you not gonna do it, why you is doing it, what's the saturation gonna be like. So they should have no questions for you. And that's how you get around that situation. Because you go in there just, hello, hi, hello, what's going on? They finna let you have it, man. Because they just want to see somebody, they want to see the nurse, but you will do. I want to take it out on the nurse, but you will do. So just play it like that. And when I came into the unit, when I received a report, the respiratory therapist on the day shift told me, like, it was a patient that she was taking care of that she had to increase the FiO2 up to 100% because the patient began to desat. They had some kind of like coughing spell. The heart rate went up. They had the suction. So the patient dropped down, sats dropped down to like the high 80s, like 88, 89. So she pushed the patient up to 100 until the sats returned to normal. So everything was okay when she left. So I get in there, patient on 100% FiO2, sat 99%. So it's my job as a respiratory therapist to know, okay, I gotta wean this FiO2 down. Even though I know what took place, the patient had this episode where they desatted. Now we doing good. It's up to me to wean this patient down. And I was like, weaning somebody down is like, it's easy, bro. You doing good, I wean you down. You start doing bad, I turn you back up. So it's like, I can't go wrong. So I wean them down like from 100 to 80, and then from 80 to 65. And the sat still remained at 99. So they was originally on 60. So I took them back down to 65. They was sat 98, 99. So that's then for the next oncoming therapist to wean them down to 60. And then take them down even more. It's just like a continuing process. But with FiO2 being weaned down and all that kind of stuff, I had a situation where there was a patient that was on venti mask. They're on venti mask. A 32% venti mass. I believe a 32%, the FiO2, the liter flow is 6 liters for 32%. I could be wrong though. But let's say it's at 6 liters to get 32% FiO2 through the venti mass. The day shift person had the patient on 10 liters coming through the venti mass, but it was still at 32%. So when I get a patient to treatment and I hook them back up to the venti mass and I put it at 6 liters, the nurse called me like, the patient is satting well, 98%, but he's saying that he doesn't feel any oxygen. So what that patient is saying is that he don't feel that high liter flow of 10 liters just coming through the mask, just blowing. Because even though it's at a flow of 10, he's still getting 32% because it's a venti mask. And I got him at 6 liters where it needs to be. But he's saying he don't feel the oxygen, but he's satting well. I'm like, okay, man. So he just saying he don't feel that extra flow coming through. He don't feel the extra pressure. I'm like, hey, just turn the flow meter up to 6 liters. Just turn the flow meter up to 10 liters. Because he wants to feel the air coming through. He's getting the FiO2 because it's a venti mask. He's getting his FiO2. His sats are good. But he just want to feel the air. That's why he's saying he doesn't feel the oxygen. When you don't feel oxygen, you breathe in oxygen. You don't feel it. You breathe it in. But it's the flow. He having a problem with that flow situation. You feel me? So I can't even try to do something the right way because somebody did it wrong. But a patient saying, I don't feel the oxygen, it'd be hard for me to go in there and explain to a patient what's the venti mass, why 6 liters is still enough FiO2 for him to breathe and be doing good when he been feeling 10 all day, feeling happy. Hey, man. Whatever floats your boat, turn it up to 10, he's still getting 32%. Let him have fun and enjoy his rest, man. On that note, I'm finna have fun. I'm finna get out of here, dog. So that was last night, man. Wasn't nothing like too wild and too crazy. I was taking a long time, been at patient. I got to see my homie. I ain't seen my homeboy in a minute. He about to have a kid. He about to have a little girl. And I told him, you already know I got my baby boy, so all that stuff my baby boy not gonna be wearing no more, especially all his shoes and his kicks. I don't mind passing that right down to you and your little girl, man. But I always say, hey, bro, whatever it is, I'll take it. I appreciate that, man, because like shoes is unisex. You feel me? So I can't give him like the daddy loves his son type shirts. You feel me? Because that's for little boys. But the shoes, man, these kids gonna be fresh, man. You know, Randy love the kids, man. Randy love the kids. Y'all be easy, man.